This is Melissa Giacomin, and this is my informative speech for Professor Saltzman's speech fall of 2009 class. Okay. Good evening, everybody. I want to thank you all for letting me be here tonight to speak to you about this issue that's very disconcerting to me as a nurse. I want to take a few minutes and discuss this issue because it really does concern me, but it should concern all of you also. And that's the problem that this country faces with chemical dependency in our nurses. According to the American Nursing Association, 68% of all nurses have some form of chemical dependency, whether it be alcohol, prescription drugs, or street drugs. And their dependency is to the extent that it's sufficient to impair their professional judgment. And I bet that, you guys don't think that's a really big number, but when you break it down, like here in the state of Florida, we have over 300,000 nurses. And so that means anywhere from 37,000 to 40,000 of those nurses have a chemical dependency problem. So it really is a bigger problem than what, many may think. What I want to do tonight is I want to take some time and I want to make you aware of the many warning signs that are out there. And these signs are usually broken down into three categories. The first category would be their job performance. And with their job performance, there may be excessive use of sick time. There could possibly be absence without notice or last-minute requests for time off. There could be long lunch hours, long breaks. Frequent or unexplained disappearances from the unit. There could also be sloppy or illogical charting. And one of the other things that really is a warning sign that we need to be aware of is job shrinkage. And that's where the nurse does the minimum amount of work for the job that's to be completed. There could also be an excessive amount of mistakes, frequent med errors, or errors in judgment of the patient's care. And you're also going to probably deal with elaborate or implausible excuses for the nurse's behavior. Now, the second category that we're going to discuss is their personality and the mental status changes. Emotional lability is where the nurse becomes unusually quiet or irritable and has frequent mood swings. We could also deal with inappropriate verbal or emotional responses, such as snapping at colleagues, uncontrolled anger, or just bursting out in tears. One of the things that we really need to be aware of and watch out for is diminished alertness, appearing dazed or confused, frequent memory lapses in the nurse. But the one key thing is that the nurse will isolate themselves. They avoid informal staff get-togethers, or they could even go as far as to request a transfer to the night shift. So that would be the things with their personality and mental status that we need to watch out for. The third category would be diversion tactics that the chemically dependent nurse uses. And one of your main ones is that they always volunteer to be the med nurse. There's a possibility that they sign out more controlled drugs than their coworkers. These are things that just keep in mind. They frequently report more spills or more waste in drugs. And their reports, they reflect excessive use of PRN meds for their patients. The as-needed drugs, you see, per se, one nurse gives one a shift, then you have another nurse who would give maybe two a shift. There could also be an increase in patient unrelieved pain. And then there's also when the nurse is questioned about med errors, the defensiveness. They are ready to
blow up.
Yes, they are ready to blow up. And they also tend to volunteer to work with patients who receive regular or large doses of pain meds. So those are some of the diversion tactics. But now that we've discussed those three categories of warning signs that we need to be aware of, the question now comes is, what is our responsibility? What is our responsibility as nurses, as colleagues, as friends, as people who just care about our coworkers. Well, it's our responsibility to our colleagues as well as to our patients to be aware of these signs and to report them to the appropriate management, your supervisors, your charges. You need to make sure that for the health and welfare of all involved, it doesn't go unseen. It's also important for us to remember that recovery from chemical dependency is possible with the right help. Okay, well, now it is important to remember that the warning signs that we have discussed here today, but it's also imperative that we do not just shrug off the signs of possible impairment. The problem is more common than many of us think, and knowing how to recognize it and report it can literally be the difference between life and death. Thank you.